right, we are back. We have Bonnie Blood and Sue Conroy here, and we are talking about Breast Cancer Awareness Month. And we had some people on a while ago about the walk.
Mm-hmm.
Right?
Amy. Mm-hmm.
Right.
Yeah. She's from Geneva.
Okay, yep. And so tell us what you two do, what your titles are, what you do.
Well, I'm the radiology manager at Conneaut, and Sue's our lead mammographer, CT tech there at Conneaut Radiology. And we're here today just to bring awareness to everyone that October is National Breast Care Awareness Month. Call in and schedule a mammogram.
Okay. And how old should you be?
That's up to you and your doctor. I mean, usually they say 40, 45. You should have your first one. But it's between you and your doctor. There's, different reasons why you would have it, a younger age.
If you had a relative that had breast
Correct.
cancer.
Right.
So, tell us about the procedure, because I think what some people are going to say, it's a hassle, it's painful, whatever.
I don't perform mammograms anymore, but I did for probably 25 years. So you come into the suite, the mammographer is there, and she places your breast on a plate. It's a little cold, and then the paddle comes down on the plate, and we need to spread out the breast tissue so we can see anything in there. So some people do say that it can be painful, and other people just feel pressure. We do 4 views, 6 views if it's your very first one, 4 views annually, and that's pretty much it.
And so, how long are you there?
Start to finish for the between registration and the exam itself and getting dressed and leaving is approximately half an hour.
Really?
That's all. And the exam itself doesn't take very long, maybe 10 minutes. And each view is, we don't leave you in compression. As soon as a picture's taken, it releases. So it's only a few seconds that you are in that compression paddle.
Okay. All right. Diagnostic mammogram and screening mammogram.
Okay, so screening mammogram is what you annually get. You have no problems. Your doctor just wants you to have your annual mammogram, so you just come in and it's a quick exam. The diagnostic one's a little bit more complicated. You would get a diagnostic order from your physician if you were to have fibrocystic breast tissue, and he may feel a presence of a nodule, a mass.
Or somebody did a self-examination and found something.
Exactly. Yeah, if you have a mass, discharge, if we do a screening and the radiologist would see an area that there's a question, then we would call you back for a diagnostic, which would include additional images, plus we may even do an ultrasound. And it's done that day. You wait. That could take upwards to an hour, hour and a half. But you also get the results that day. Radiologist will speak to you. We do those on Wednesdays.
At Conneaut.
At Conneaut, that the radiologist will be there.
I think it's kind of a key thing is that you find out right away. It's not like you're spending another week before you find out.
We can get you in within a week or two.
But during that exam.
Oh, yes.
Yeah. Yeah, because it is very stressful for a woman when they hear, okay, you need to come back and get more images. Of course they're going to think, I have breast cancer. It's very stressful, so it is a great thing that we can do it right on site. And
have it all taken care of and all. Seems like I saw some statistics that showed that when there is the diagnostic mammogram, that the percentage of times that there is cancer is not that much.
No, it's for a diagnostic for, like, say we called you back, we call them callbacks. It may be just a tissue on top of a tissue, and we have to spread it out and get targeted area. It doesn't necessarily mean you have breast cancer if we call you back. A lump doesn't mean you have
many
breast
times
cancer.
It is not breast
cancer.
cancer.
No, it's not.
Many times.
And even if we recommend you have a biopsy, it doesn't mean you're going to have breast cancer. There have been, many biopsies come back benign, which, I mean, you can go to get a stereotactic, or you can have the actual lump or mass removed, and they do a biopsy that way. So, I mean, it doesn't necessarily mean you have breast cancer if we recommend for you to have a biopsy.
Right.
I know your mind's going to go right to the worst possible
Sure,
case scenario,
that would be-
but that's not the case.
I could see people putting it off because they don't want to know, and when they're spending a lot of time worrying for no reason.
Right.
So, what are the risks? The risk factors for developing breast cancer, like lifestyle and stuff, or
Number one thing is a female.
yeah,
But men
do get it.
Men do get breast cancer, absolutely. But that's the big one. Age. The older you are, your risk increases. If you have a family history, if you have the genetic BRCA, you've probably heard of that one or two. If you've done a genetic testing and that's positive, that increases your risk. Long-term hormone therapy, your weight, alcohol consumption. Those are all contributing
What about
factors.
smoking? Does that matter?
Smoking's just bad for your period.
Yeah.
I don't really think they say that contributes.
How about diet? I know you.
Well, your weight. If you're overweight, that can increase your risk too.
But it's not like you eat too much of this or that. It's going to.
But it causes you to be obese, so.
So don't do it.
Right. And if you have fibrocystic breasts and you drink a lot of caffeine, they'll make them more tender, but doesn't contribute to breast cancer.
How about exercise? Every time I have a doctor on, one of the things they tell you to do is exercise for anything and everything. Does exercise help with? Well, again, I know it keeps your weight down.
Right. Right.
So
Well, I've never heard anything about exercise with breast cancer.
No.
Somebody somewhere.
But again, obesity if you don't exercise, so.
What are the ways that breast cancer is detected? We were talking about the self-examinations. Is it just seeing your doctor regularly?
Your annual mammogram is the top thing. Monthly self-breast exams, and then you should see your physician, and he or she will do an exam as well. Those are the three things that you need to do. And know your body. If you feel something isn't right, call your doctor.
So what kind of stuff? Is there anything besides like a lump or a...
Pain, change in the skin. The skin will get like a funny feel to it. It'll be a little bit harder. Maybe discharge from the nipple. Pain and lumps are the big thing.
Mm-hmm.
Now, if I had a pain, I would be more concerned. Is that there was cancer? Is there any more chance that's going to be if you go in?
Depending what's causing
it
the
could
pain.
be a cyst, and cysts are painful,
Yeah.
and cysts are benign.
Mm-hmm.
Right.
And a lot of women have cysts.
Right, or it could be just fibrocystic changes, and that's normal, and that's painful also.
There's also I'm wondering, I guess it's less now, but people that don't have insurance, or I don't know if there's a copay sometimes for this. Do you know what kind of services are there for people?
We are involved with the Ashtabula County Breast, what is it called?
BCCP.
BCCP. We have the number in our department you can call. Now they only have a certain amount of money for the year. Once
Right.
it's gone, it's gone. But there is an option to call that number and see if they can help you.
Okay.
And a lot of insurances will do, that's part of the wellness, you get your mammogram. They want you to have your screening.
preventative.
It's preventative, so they
Yeah, I
want
would
you to
think
have it.
that would behoove them to offer that. Do you get to see more people because more people have insurance now with the Obamacare? Does that make any kind
I
of
don't think
impact?
we've really seen any difference.
Mm-mm.
No.
What percentage do you think of women that should be getting the? I guess that's kind of
Should be getting it, or are they
are
actually getting it?
actually getting it. Do you have any ballpark figures?
No, I have no idea about that. No.
Not enough.
They run out of money with the BCCP every year, so
But they
obviously
are-
there's not enough, yeah.
But for most people, their insurance should take care of it.
Yep. Nearly all insurances will.
And they'll actually
use
send you
preventative.
letters. I mean, our
Oh,
insurance will
really?
send you a letter saying you haven't
It's
had
time?
your mammogram. Or you haven't had it. We don't have record of you having your mammogram. You know, you need to get to your doctor and get your order.
Okay, so is it, if we try, is it an annual thing, or is it like, if you're okay, then you're good for so many years, or?
That's between you and your doctor. That's a very, you know, yearly would be better, you know, but if you reach a certain age, you know, I have some of my elderly patients that will come in and like, when do I stop doing this?
Is there a time that they stop?
We recommend them to come in every year, but it's up to them. You
Yeah,
know?
I think some physicians might say in your 80s, you may die of natural causes before, because breast cancer grows according to your age. The younger you are, the faster it grows. The older you are, the slower it grows. So I think there is some thought with some physicians that once you hit your 80s, probably natural causes will come before the breast cancer. But I think everybody should get a mammogram. Who do you really want to die from breast cancer? You know, it's a horrible disease to die from. So I recommend that everybody get it.
Yeah.
Something that you can prevent, not prevent, but catch and do something about.
Okay, we have Bonnie Blood and we have Sue Conroy from UH Conneaut Medical Center, and we're talking about Breast Cancer Awareness Month. And what are any statistics or anything on a woman's chances of getting breast cancer?
1 in 8.
You knew that pretty quick there.
We've known 1 in 8 for years now.
Yeah.
It's been 1 in 8. I'm surprised it hasn't gone up or down, but it's 1 in 8.
I would think that equipment-wise and everything, that it would be less stressful now to have a breast exam than maybe years ago, and be better. More women will want to get their breast examinations done, and ipso facto, there'd be fewer people with breast cancer.
Well, I would think we would detect it faster, but we'd
faster.
still detect it. So.
Well, I'm detecting it faster.
Right. That's what the key is. It's not getting. We're not getting rid of breast cancer. It's still there. It's just we're catching it before it gets bad.
So, how about statistically why catching it early versus catching it later? Do you know what the survival rates are? And
That I couldn't tell you that.
I would imagine though, the better, the sooner you get in, the better.
Right.
All right. So what happens? Somebody is detected with breast cancer. Then what do they do from there?
It's personal preference. A lot of them will do breast conservation surgery. They'll take the mass out. They can do radiation. They can do chemo, depending on how far the cancer has it spread out of the breast. Has it gone into the lymph nodes? There's a lot of things. They have to stage it. And
what are the survival rates? Do you know, as far as breast cancer, somebody that has it? I hear these people that, or the breast cancer walk, where somebody had breast cancer 55 years ago and they're still alive. I mean,
back then they were feeling it before they would
Detect it.
Right.
That's how they would detect it. So it's already, you know, it all depends. I think a lot. There's a lot of different factors. I don't have any actual statistics for you for that. But they used to say, what, 5 years
With survival?
for survival is, you know, they strive for the first 5 years and then go from there.
You're a cancer survivor.
Right after 5.
okay.
Because they do, a lot of times they do treatment for 5 years. They take tamoxifen or other drugs.
Where is the surgery usually held or done?
It could,
A lot of referrals we're sending down to Chagrin Highlands
Right.
because our radiologists are we have the UH radiologists. It's a group of women. All they do read breasts, ultrasound breast, mammography. They do the stereotactic breast biopsies. A lot of times women prefer to go down there with those doctors. They're at Case.
the brain breast.
They're dedicated to reading mammography. So I think, you know, we have a great partnership with UH Case.
Okay. Digital and conventional mammography.
The digital, if you got to think of it this way, digital is like a digital camera versus a film camera.
So you're going to get the results faster.
It's sent directly through the computer down to the physician down at Breen Breast Center in the Sideman Breast Center.
Which is a case.
Which is a case. The patient's not even left and they're there. So it's stored online. It can be, the images can be manipulated online. You know, they can magnify them, change the density and with the images. Whereas when we had film screen, what it came out looked like, you hung it up on a view box. They could lighten it up with a we call them a hot light. But I mean, we haven't done conventional mammography since 2009. Was the last time. So we've been digital for quite a while.
And then you'd have to wait for somebody to come in to read it. And
right, you'd have to take it to a doctor. They'd have to read it, and then you had to wait for the processing. Whereas now we take the picture, pops up on the screen. We're good. Let's go on to the next one.
So it's literally like your cameras today, where before you'd have to take it to
get a
develop
hard copy.
Yeah.
Right.
Versus looking at the picture. I take pictures of my grandkids when they were little. You'd have to take the picture, then you had to show it to them.
Right.
So.
Right. So that's it's, if you think of it that way, it's digital versus.
And the image quality is so much
amazing.
better digitally
I bet.
than film. Yeah.
So you have better equipment that can better test for cancer, and then the procedure for looking at the results is better. You can get in and look at things better. So
Yes.
there's a multifaceted thing
Everything
here.
changed all at once.
Radiology is such a technology-driven practice. It's always ever changing. The CT scanners, the MRIs, mammography. It's just always technology-driven.
So one day it came into work and it was all different.
It's a long process. We're getting a new CT scanner in December, and the process has been long and cumbersome. Sue's already gone to Cleveland because
I was going to ask if you've been having training.
Yeah, you and Becca have gone for the whole last week for training on the new, you just don't plug a big piece of equipment in and say, okay, here you go.
Right.
There's a lot of little things that you have to know and be trained, and so we're getting new technology again.
So what does that mean for the patient?
For the CAT scan,
Yeah.
it's going to be a lot quicker. Images are going to be nicer. We're going to be able to do
more procedures.
Mm-hmm. We're doing angio now, but we're going to be able to do more of a range of angio.
So this goes beyond breast cancer.
Yeah,
we're talking about everything.
Yeah.
Right, total, the whole body. Yeah.
Right.
So next time I fall off my bike and break my collarbone, you'll be able to see how bad I messed up.
Well, we have digital radiography as well.
Yeah.
We have the conventional kind and the digital kind. It all goes to the computer. It all gets sent to Cleveland for the radiologist down at Case to interpret all images. But Conneaut's very, very blessed to have all this digital equipment. We're very lucky.
And you say all the equipment at the hospitals, it's constantly changing.
Yes.
Constantly.
Like right now, we're in the process of getting our new CT scanner. The digital mammography was in 2009, but we've already had an upgrade. It's just always a constant, ever-changing field. So it's exciting.
So you can't hark back to the good old days on something like
this.
The
good old days are gone.
Yes.
That's going to be reassuring, though. When I talk to health people, I kind of going in with my parents to anything is that for a procedure or a surgery or whatever, is that a lot of times the health officials, they do this every day. They do this 10 times a day, 20 times a day, and for some people it's like this is the first time.
Right.
And so talking about the changes in technology and what services they're going to be getting, it's got to be kind of reassuring. You can say, listen, we're going to do this faster and maybe a little less painful. And
When University Hospitals takes over an entity, you may know they just took over Robinson Memorial.
Oh, in Ravenna?
Mm-hmm.
Portage.
Portage. It's called UH Portage now.
Oh,
instead
really?
of Robinson.
I did not know that.
Yes, we partnered with Elyria, with Parma, now Robinson. The best thing about an affiliation with University Hospitals is what they say is you get the same care in Conneaut as you would down at Case. Now, do we have all the equipment? No,
Mm-hmm.
but we're held to the same standards that the techs down in radiology at Case are. The images better be good, and they better be perfectly interpreted. So we do what Case does.
Uh-huh.
That's their motto. That's their slogan. You get care at Conneaut like you would at Case.
Is
Also, service excellence as well too. You get. I think we always have done well with the service excellence, but they preach that our patients are who we're here for. Our patients. We need to take care of our patients, and University Hospitals has always pushed that. You need to be kind. That's part of our pillars. That's part of what we do. You always have to keep the patient as first. So I think it's great.
Yeah, usually when they go to the hospital for whatever, it's not because they're looking for a good time.
No.
Right.
It could be some, worst day of their life at times, if they're in the hospital. It could be, it could be a bad time for
They
them.
could be told that they have cancer of the lungs that day.
Right.
And healthcare workers, we're doing this every day. So you could tend to get a little hardened by that because that's what you do, but that's always at the forefront that's a patient. We have to take care of the patient like it was your own mother.
Yeah, it kind of brings to mind when my mother was really bad and was taken to the hospital emergency room for the umpteenth time, and the doctors pulled us into a room and kind of gave us the facts, and I was impressed at the time that he stayed with us as long as we had questions. It was like my brothers and me and my grandson, and he just, you think doctors, if they got to be here, they got to be here, they got to be there. And he just stayed there with us until after he gave us the facts as to whatever questions we had. Can we do this? Can we go somewhere else? And
That's what you need.
yeah. Because it's really, ultimately, it's all about, there's equipment, and it's good to get new equipment and all, but it's people and how you deal with them and all. Well, this is an example. Okay, this is Breast Cancer Awareness Month. Tell us somebody that's just turned 40, or the doctor says you need an examination. What do they do then? How do they make an appointment? Kind of give us a quick 50-cent review of the whole
Or
thing.
you want me to take
You
it?
go for it.
Okay, so the first thing you need to do is get an order from your doctor. You have
Okay.
to have an order. On top of the order, there are numbers to call. We do have a centralized scheduling department now that streamlines all the patients that call.
Just like an 800 number?
It is kind of like an 800 number, yes, because I don't want to get into the scheduling specifics, but the reason they're doing that is like if you can't get into Conneaut on Tuesday, maybe you can Geneva. So it's really for the patient. But I do want to emphasize, if anybody has any trouble scheduling their mammogram, call the radiology department directly and we will take care of you, because sometimes you might get lost with the press 1, then press 2. So if there's any problems calling us, call the department directly. And we will take care of you.
How do they do that? Is the number in the phone book? Or
Yeah, well, I will give the number if anybody wants it. It's 593-0150. But you can look it up in the phone book as well.
Okay.
Yeah.
And
So
on
there
the
is a
website.
number to call, but if you have issues, give us a call. We'll take care of you.
I was in radiology after I fell off my bike and broke bones and ribs and stuff, but I can't remember too much about it. But that was a few years ago.
Yeah.
All right. Well, thank you very much. So the word is to get the exam and don't stew over it too much beforehand, because the chances are that it won't be that uncomfortable and that there won't be a...
It's uncomfortable, I'm not going to lie, but
Right.
it's quick.
Yeah.
I mean, it's not like you're in there for 5 minutes. It's a few seconds. So,
Well worth it.
well worth it, yeah.
Okay. Bonnie Blood Sue Conroy from UH, and you're both in Conneaut.
Yep.
All right. Thank you very much.
Thank you for having us.